Hey there, welcome everybody. Shut up and listen to her. Her health matters, boy, it does.
Yes, it does. Yes, it does.
I'm here with Tiffany Kane. We are so excited to be seeing everybody today. Happy holidays. If I don't remember to say that later, we'll be back in the new year after this, but
On my
we're
birthday,
on your birthday. That's
January 2nd,
right.
my birthday. So celebrate my birthday with me on January 2nd, everybody.
That's right. Um, we are going to spend today, this is what I call post-op the aftermath. Because Beverly says happy birthday.
Hi, Beverly. Thank you.
um you've been through the ringer,
I
so
have.
yeah, just to say the least. um and I kind of wanted to go, I wanted to start today talking about what it's like to be in a clinical trial, because I think we hear about them and different things, and it's very kind of mysterious to a lot of people. So I thought maybe we'd start there, as you know, what has it been like? What is it like being in a clinical trial?
Yeah. Okay. We can totally start there. First of all, I applied for several clinical trials when I was so frustrated with the gaslighting in my Kaiser care. There's a lot of clinical trials being done for all kinds of things, but there's quite a few for resistant hypertension. And so I applied, and I didn't qualify for most of them because of all my kidney issues I have. But this clinical trial accepted me. And so I felt really lucky. I was like, all right, this is cool. And it's UC Irvine, which is highly rated, highly, wonderful, not too far from where I live, about half an hour from where I live. And UC Irvine, that's my alma mater, that I went there and got my teaching credential there. Um, and it's excellent health system, right? So I was like, okay, so it's been months of, to get accepted into a clinical trial, they only take people that really fit those parameters because they need really good data sets and they need to keep the data consistent. Um, and so some of my parameters I had to hit were like, I had to be on 3 different hypertension meds, had to be on those meds for a certain amount of time. Those meds couldn't be managing my hypertension, right? Like my hypertension was out of control. I had to do what's called a 24-hour ambulatory testing. I had to get all kinds of scans, ultrasounds, CTAs, tons of blood work, urine analysis, all of that kind of stuff. Because, they don't want me, they can't accept somebody that's in kidney failure. And so, anyway, it's an extensive workup. And then, as soon as I passed all that workup, they said, okay, you are accepted and your surgery is scheduled for December 4th. And this clinical trial it is to help with your sympathetic nervous system. So, for many of us with resistant hypertension, our sympathetic nervous system is in overdrive. And if you don't know what the sympathetic nervous system is, that is your fight or flight part of your sympathetic your nervous system. You've got parasympathetic, which kind of calms you down. And in people with POTS, that's overactive. And then parasympathetic is your fight or flight, adrenaline, all of that kind of stuff. And with people with resistant hypertension, oftentimes that's in overdrive and won't calm down. The nerves around your kidneys, on the arteries of your kidneys, when your sympathetic nervous system is in overdrive, those nerves around your kidneys are constantly telling your kidneys, danger, 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 things are not good. Kind of close those vessels down and send a lot of fluid out. So raise those pressures. So this clinical trial is to do what's called a renal denervation, which is basically to kill those nerves around your kidneys. Now, they're not the only things that control hypertension, which I got really good firsthand evidence of with all of this insanity in the hospital. But it does help with kind of the most resistant part of hypertension, where your body just is constantly in that constant fight or flight. And Yes, there are like stress components. Obviously, when you're stressed out, your sympathetic nervous system
Mhm.
gets working. But with people where your sympathetic nervous system is not working appropriately, it doesn't matter. I mean, you could be in the most zen state possible and your internal system is wackadoodle, right? It's just not. It doesn't matter how many anti anxiety meds you're on or anything like that. Sorry, my back is hurting so bad.
Yeah, I know. We've got you. Last time we saw you, you were in a hospital bed, and now you're in your own bed. At least you're home,
I'm
but
home.
still dealing with a lot.
Yes. Yes.
Debbie says my hubby had Alzheimer's and was in several trials. They stopped one cold because someone died from the meds. Stopped
Ooh,
one because the admin ran off with the money. Oh my word! She's been,
Debbie. Oh
yeah,
my God. That's what a story. Oh, we need to hear her story at some
yeah, we
point.
do.
Oh
I
my
know
God.
for sure.
Okay, so long story short, got accepted, blah, blah, blah. Surgery was supposed to, they scheduled 4 hours for the surgery, but the doctor's like, it's probably going to be about two. We want to give time, they count the time for getting the room prepped and getting me prepped and getting me under anesthesia and then waking me up from anesthesia. He's like, so expecting the surgery to be around 2 hours and then, the pre op and post op to be another like hour, hour and a half. Like, okay, girl, I didn't wait. So that was 6:30 in the morning. I didn't wake up till 6:30 at night.
Wow.
My surgery ended up being almost 10 hours long. So we'll get into that later because that doesn't answer your question of what's it like to be in a clinical trial. What's it like to be in a clinical trial is you are very closely watched and closely monitored. There's probably I probably had 6 or 8 surgeons on my clinical trial team, and they would come check on me throughout the day. And they were amazing. They were
Mhm.
wonderful. They care so much. Like, I got the Cadillac surgeon treatment as far as like surgeons coming and paying attention to me. I have a really good story to share with that. Um, but basically, I'm closely followed now for the next 5 years.
So it is a
And
5-year,
it's a 5 year.
it's a 5-year commitment. I mean, so when you're thinking about these things, that's the other thing that I don't think people realize is that it can be years
Yes.
that you have to follow through with things,
Yes.
and you have to be checked on and tested, watched,
Hmm.
and other things. I think, it's that's kind of what I really want people to understand is there's when we're searching to get the right answers and to get ourselves healthy, that there is a process that we
Yes.
need to be prepared for.
Yes. Yeah. And when you compare the dismissiveness and the tiny, tiny little bit of time you get with even your specialist in regular medical care, 5 years of somebody paying attention sounds kind of nice.
Yeah, true. Very
I,
true.
I at least know for the next 5 years, people are keeping an eye on my kidney health and my blood pressure, and they're
Hmm.
closely monitoring because at this point, they've spent a shit ton of money on me, Bree.
Yes, they have.
um, and so anyway, but yeah, it's a lot of doctor's appointments, a lot of follow up appointments, a lot of blood work and scans and all of that over the next 5 years. A lot of like, I have to keep a blood pressure diary and that kind of stuff, but it's very worth it to me. I'm a data person anyway,
Hmm.
so I like being able to keep data. And then I um I don't know, it's just
It's a lot.
it's it there's something when you're gaslit, 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 and I'm sure the people listening know what I'm talking about, where you really start questioning yourself, even though you know what you're feeling and you know what you're
Hmm.
experiencing.
Absolutely.
And then when you have doctors that listen and ask questions and understand that what you're going through is a big deal. In fact, they've created a clinical trial around it because they know it's a big deal and they need to take care of it. And then suddenly you're like, wait a minute, this is important. Like, you really want to know how I'm feeling? You really want me keeping a diary? You really want to know this information? This is important to you? Okay. Like it starts healing those self-gaslighting wounds
Mhm.
when you've been fighting so hard with your medical team and you don't even realize how much you've been gaslighting yourself because
Exactly, yeah.
they've been doing so much gaslighting that it makes you gaslight yourself, even as you're advocating for yourself and fighting against them. Like, there's kind of a lot of self harm that ends up happening. So,
Uh, and when you say self harm, I think I want people to understand that because I even had that a moment this morning. Went out and had dinner last night. I got a cup of soup. I wanted to go get dinner. I didn't want to cook dinner. I wanted to have just a nice night out, right? And I ordered a cup of soup. It literally was probably between a quarter of a cup and a half a cup in size, right? Like it's not very much. And yet I knew after I ate it, I knew this morning when I got up and how I felt, I knew that I'd had way too much sodium,
oh,
even in that small amount. And I had the F it attitude where I, and that's the self harm,
yeah.
right? Like I knew better. I shouldn't have eaten that, but I just wanted someone else to make me a cup of soup, right? And like I can't open a can of Campbell's because it's not healthy for me. And this is, at a restaurant, I'm sure there was even more sodium. I mean, that little thing probably had more than my entire day's worth of sodium in this little very delicious, extremely enjoyable little tiny portion of soup that I loved every bit of. But I did have that is self-harm. That's me saying, screw you. Nobody cares. I don't care at this point. I'm just going to do whatever because nobody knows what's wrong with me and nobody cares what's wrong with me. And I'm
Hmm.
tired of battling this by myself. And I think, those are some of the self-destructive behaviors. And then I thought, and then the next thought to myself was because I'm going to see my cardiologist in a month. And I know that they're gonna be like, yelling at me about things. And it's just like, dude, I beat myself up about this all the time. I don't need to come in and ask for help and then
Hmm.
have you beat me up too. So this is the pattern my brain goes through. I shouldn't have eaten that. I know it was delicious. And I'm not here. I didn't have this entirely huge bowl. It was one of those little itty bitty tiny little cup. Like when they say a cup of soup, it's like a half a cup if you're lucky of soup, right? Because
Hmm.
it's usually already a fortune in price. So I'm not doing things that are radical and crazy and horrendous for myself, like eating a whole chocolate cake or you know what I mean. That little tiny bit was so bad for me. That was enough of torture for my body that I shouldn't have even had that. And I spent the rest of the time beating myself up about it and feeling
And,
bad about it. And even it was last night and even today start thinking about it.
for most people, half a cup of soup is actually them eating healthy,
Yeah, I know.
right? Like they get soup and salad and they're like, I ate really healthy today. And so for you, that half cup of soup to destroy your body, like, where's the fairness in that? That's just not fair.
It's totally not fair.
It's
That's
not
the
fair.
that's what we live with, and we're trying
Mhm.
to, we're doing when you're trying to do all the things right, and then you're going to be a human being. You're going to make mistakes. I'm going to eat the thing that's not good for me. Not I can't make perfect decisions all the time, and sometimes I just really want it, but it really, really, it's completely overwhelming and it just makes you feel so miserable about
Mhm.
yourself,
Yep. Yep.
So, how are you feeling? How are you doing?
Well,
Because
my
you had an experience. This wasn't just I mean, and we are the 10-hour surgery, but since we talked to you right after the day after surgery, your original surgery, but so much more happened after that.
oh my
So
God,
kind
Brie.
of fill us in.
Okay, so like Friday morning, I was doing pretty good, right? I was like, all right, we got this. Like, yeah, it was a rough surgery and there were complications during the surgery, but I'm okay. I got this. This is fine. At that point, I was still just on broth and clear liquids. And they came in like right after and were like, okay, we want you to actually eat real food. So they brought me the menu from the cafeteria, which I don't
You
get.
mean,
Right. I don't get it because everything on there, it was like hamburgers and like heavy foods. And I'm thinking, all these people that are sick in the hospital, like, where's the soup? And they had 2 or 3 soups on there, but none of them were gluten free.
yep,
So, like, the only soup that was gluten free was a pho. So I thought, okay, I'll get the pho. I love pho. Pho, that beautiful Vietnamese, like super healing and healthy, made
love
with
it.
bone broth and
Very salty, but I love it.
right, right. But I'm like, oh, that'll be nice. So I get the pho, and there's maybe a quarter cup of broth, maybe. It's this
Mhm.
really shallow bowl. Big old noodles, big pieces of cabbage, big chunks of beef, big chunks of tofu that have no flavor. And I'm like, okay, this isn't very belly friendly. I've been on just broth and, the day before, no eating. And like, this isn't a fun way for my belly to wake up. So, but I ate a little bit of it because they're like, you need to eat.
Mhm.
Um, and then so that was about lunchtime. And then dinner time, I had a turkey sandwich. Now, by the time my turkey sandwich came, I'm not feeling great. I'm like, I just don't feel good. But they're like, no, you need to eat. Like, you got to wake your bowels
Mhm.
up, blah, blah, blah. So I had like half a turkey sandwich and a couple potato chips. And I gave the rest to David. I'm like, I can't eat the rest. Oh, girl. Oh, my God. Within an hour or two of that, my belly gets distended. I look like I'm 9 months pregnant. One of my incisions, this massive bruise just starts swelling, and then I get this weird indentation, like protrusion around that incision. So I call my night nurse in. It's probably about 7:30 at night. His name is Thomas. He was an angel. And I'm like, this isn't, something's going on. Something's not right. He agrees. He gets the surgeon to come back in. Surgeon looks at me and pokes my belly a bit, and he's like, I think you're normal. You probably have a little bit of an ileus, which is when your intestines are sleepy.
Mhm.
It'll wake back up. We really want you, like, try to toot, try to pass some gas. This bruise, wouldn't worry about it. You had complications during surgery, and you're going to have some bruising because we really had to like go at you. Like, okay. By about midnight, it is obvious. I'm vomiting. I'm not good. My belly is hot, super distended. My nurse is all, forget this. I'm calling the rapid response team. My oxygen had dropped, like all this. Rapid response team comes in, and it's like that scene in Santa Claus where all the little elves are like with their backpacks and they're like flying in the room. That's literally, they come in with their backpacks and they zoom in the room, and it's like 4 nurses. And they're checking me out, ultrasound and blah, 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 blah. And they're like, yeah, something's not right. Um, they order an x-ray, and everything takes time.
Oh yeah.
So a couple hours later, get an x-ray. X-ray comes back. Okay, something's not right. It looks like a bowel obstruction. And so then I get a CT. So it ends up being like midday Saturday. I finally get the CT. And yes, the CT shows that I have a massive bowel obstruction. That incision that was all bruised and terrible, it had opened up inside. So I had a hernia inside, and my bowel had gotten caught up in there and twisted. And so part of my bowel was completely collapsed, like totally. There was all collapsed on itself. And then the other part of the bowel was very swollen and inflamed. Like, I think it was around 4 centimeters swollen. So Monday I went back in for bowel surgery.
Wow.
And now Friday, probably about 3 in the morning, they had to put a NG tube in, nasal gastro.
Mhm.
Oh, I don't. I don't wish that on
No.
anybody.
Mm-mm.
The first one took 3 times to get it in.
Oof.
It's horrific. You feel like you're gagging, you feel like you can't breathe.
Yep.
It's a pretty thick tube. It's pretty hard because it
Mm-hmm.
has to be able to handle your stomach acids, and then it pumps your stomach acids out through your nose. And you see all this disgusting stuff come out because your stomach makes about 2 liters of acid a day, bile, to help break your food up. And if it can't empty into your intestines, well, you're going to vomit it up, or they're going to,
Which is going to cause a lot of damage too to
yes.
everything. And yeah, because I had a TEE, transesophageal echocardiogram.
Mm.
That's what TEE stands for. I don't wish that on anyone either. And you're awake for it, and they're getting images of your heart through your esophagus.
No,
So
so
they're putting this big tube down
oh,
you, and they do give you stuff to help you relax, but it was still a horrific experience.
you
And
feel like you're
choking
suffocating,
and
choking is
gagging,
yeah.
and it's horrible, and I threw up during
Mhm.
while the tube was still in me, which was insane. And it was traumatic, my body.
Yeah,
And then
yeah.
everything is like sore because you've had this thing down your throat, and it's, your body's a soft tissue, and this is a hard object, so it's like scratching, and it's just, I was hoarse, and yeah, it was a pretty night. So I can't imagine having to have had that in. One of my biggest fears going through all the surgery I did and waking up with all the tubes down me, because you wake up and you have all of you have the breathing tube, and you're intubated, right? So I was intubated. I was actually on a bypass. They do all this stuff when you, for open heart surgery, they put you on all of these different things, right? So and so when I woke up and all of that was still there, that was the thing. I got a meditation tape from a friend of mine who's a doctor, and that was probably the only reason that I got through that part of it. They're like, "You'll never remember it. Don't worry, you'll be fine. You'll be kind of aware, but you really won't." I remember every single detail of that horrific experience. Thank you very much. I know exactly what was happening. I felt like I was suffocating, and I couldn't move because they give you medications that keep you from moving, obviously. So you don't whack them in the face in the middle of surgery. You don't want to do that. They might nick something, and they don't want to cut. So you can't, you're telling your body to move and to speak and to alert, like, I'm awake, I am here. But I must have done just enough movement for them to realize that I was coming to and that I was aware. I remember trying to move my finger like as much as I could, and it was very slight, but I just kept like moving it, like all my focus wanted to just move your finger, let them know, because they were asking me stuff, and I was like not moving, and then they would ask me something, and I was like trying to wiggle that finger just a little bit, but it was enough for them. And then they finally cleared out all the phlegm and everything that was caught in there, where I felt more relaxed, because I felt like I was drowning, because I had all this like phlegm and everything else, because I had all these tubes in, and my body's going, no, no, get it out, right? And so, but I had a breathing tube in, so I knew I was breathing because I had the breathing tube, even though it felt like I was drowning at the same exact time. So
Yeah.
I remember all of it. Thank you so much. Don't ever tell anybody; they won't remember it, because they will. Um, so you go through, your body went through so much. Do you regret any of it? Did you have, was there a point at one point where you said, why did I sign up for this?
There was absolutely a point. I needed to get 2 different NG tubes. The first one, they just didn't place it right, and I gagged the whole time. It was hours and hours and hours of gagging and gagging and gagging, and eventually, in one of my gagging episodes, I grabbed it and I yanked it out,
Yeah.
and then I vomited everywhere, of course. And then they had to put a second one in. There's a sweet story around that I'm not going to get to at this moment because you asked a different question, but the second one was kind of, it was awful, but it was Anyway, good story around that one. So it got to be Thursday night, which was a week after my original surgery
Mhm.
and 4 days after my bowel obstruction surgery when I still have the NG tube in. I'm still miserable. I'm still like my bowels still aren't moving because now I've got an ileus. So my bowels just, they didn't wake up. Never, they just didn't wake up. And it's so painful. It's so painful. And I'm just, my son is coming home from college on Friday and I want to be there with him. And I'm still in the hospital and I haven't had a shower in 10 days and I feel gross. I haven't eaten, no water. I couldn't swallow.
Mm.
So no water. They had to give me, all of my nutrition came through my IVs, which meant that I had 16 IVs fail and probably about 30 pokes. I mean, look at this bruise.
Yeah.
That's a sweet nurse decided to put the IV in and just poke around until she could get my vein. What the F? Like you can literally see the
Yeah.
in this bruise. When I say sweet nurse, that one wasn't good. Most of my nurses were amazing. Anyway, it was Thursday evening. I was down. I was like depressed. I was crying. It
Mhm.
was just too much. It was just too much. And I'm just standing up, like leaning on David and just crying. And I'm like, I am so sorry. I'm so sorry I put us through this. Because I mean, he's with me nonstop. He can't work. I can't work. So it's messing us up financially. He's sleeping on this hard bench that they call a bed, but it's really a bench. And, you know, he's been by my, so it's stressful on him, stressful on
Mhm.
me. And I was definitely, I am so sorry. I'm so sorry. I'm so sorry. By the next day, I was fine. It was better. Got the NG tube out on Friday. My son came to visit me at the hospital. Things were much better. And so now at this point, no, I don't regret it. Um, it is frustrating that things went the way they did, but it's nobody's fault, if that makes any sense. There's
Mhm.
no, I had my anatomy is so effed up. There wasn't really anything the surgeon could have done differently. And in
Right.
fact, he did the best thing he could for me. Very easily, he could have my right side went great. He's like, it took an hour. Immediately, I saw your arteries relax, your blood pressure dropped. It was perfect. Moved to my left side, and all hell broke loose.
Mhm.
He could have stepped away and gone, okay, we're not finishing this clinical trial. Not a good candidate. My kidneys were adhesed to my intestines. He knew I had duplicate renal arteries. Usually they are like this, either in front of the aorta or behind the aorta. Mine are wrapped around my aorta.
Oh my word.
Usually that can be visualized in um, imaging.
MRIs and CTs, yeah.
Bree, I've had dozens from
I've
UCI,
never
from
seen that.
Kaiser, from, you know, like over the last, you know, ever since we realized, like I was about 40 when we realized I had some significant kidney issues, I have had so much imaging done on my kidneys in the last 12 years. Nobody's caught. It's called a circumaortic renal artery where they wrap around the aorta. So that surgeon, the precision he had to do to be able to do the nerve denervation, the denervation on my arteries that wrap around my aorta without nicking my aorta.
That's crazy.
Like he's talented.
Mhm.
With my kidneys being adhesed to my intestines.
Yeah.
Which by the way, my PCP was like, you can't feel spasms in your kidneys. Hey, biatch, when your kidneys are adhesed to your intestines and your intestines are constantly moving, yeah, you can. But anyway, adhesions you can't see on imaging. So there's no way he could have seen that.
Right.
And the circumaortic, I mean, 12 years of imaging, it never showed up.
That's crazy.
And so he went in and was completely surprised, like, oh my God.
Yeah.
So he had to do extra incisions to kind of get around that. And so anyway, there were just so many complications that
Couldn't be foreseen.
couldn't be foreseen, and that
It's
they handled really well. And my my surgeon, my clinical trial surgeon, is a urologist. Sweetest man, such
mhm.
a great man. And once he realized I had a bowel obstruction, he called in the colorectal team, surgical team, and he said, "Okay, I am now having them make the call on what to do as far as surgery and all of this because they're the experts. I will be in the room, I will be observing, I will be helping, but they're the experts for this part." And oh, Brie, like the respect that gave me for him, instead of
Yeah.
him thumping his chest, she's my patient, I'm making the call. He said, they're the experts in bowel
Mhm.
obstruction. I'm letting them make the call. I'm bringing them in. And there was a whole team, like 4 or 5 of them that were on me because
Wow.
clinical trial patient. Um, so I felt like I got really good care. And sometimes, complications, they're just, you can have the best surgical team in the world, and our bodies are flippin' insane things,
Yes,
and
they are. And
you're
you
going to
can't
have
predict.
complications. You cannot.
Well, you kind of touched on where I want to go next. You were on a journey for this that was so overwhelming, and it really could crush you, as it would most anyone that's gone through that. But you came through it all, and I know I've been watching you online and we've been talking, and I know that a huge part of it has to do with the care that you were given. So I thought we'd kind of shift a little bit into maybe some shout outs and talking about, because we kind of bash on people a little bit on this podcast. It's okay because some of them really deserve it. But also, we are right there to be able to give people, the that they need for really going above and beyond. But it from this is from an outside perspective. To me, what it looked like, and from what you said, was they just really hire great people, because
Mhm.
I don't know that you were giving any other special kind of care. I think innately it's how they treat people that they care for. And so tell us a little bit, give us some shout outs about this incredible team, because I know you had some really spectacular people that really helped carry you through this.
Okay, so I want to start with nurses and nursing assistants. Okay, so the nursing assistants, I don't think get paid very well, and they see like 11. The I was on. It's called a step down unit, so it's a step down from ICU. And I got moved there when with the bowel obstruction. They stepped up my care to the step down unit. It's kind of funny. Um, and it's a 3 to 1. So the nurses have 3 patients to every one nurse in the step down unit. ICU, they have 2. The surgical telemetry unit, it's 4 patients for every nurse. Okay. So I was in that, a little bit more attention from my nurses, but the nursing assistants still have like 11 patients that they're checking on. They were so sweet. I loved them all. They would have conversations, they would check, they would, and it's so, you're very vulnerable, and nursing assistants handle all the like kind of gross stuff, the pee and the
Mm-hmm.
poo and the all of that stuff, and you're in your most vulnerable state. And they treated the patients with such dignity, as much dignity as you can have in those very, very vulnerable states. And I really appreciated that, because in a lot of places, the nursing assistants, I don't think, are treated very well. And I felt like the nurses were respectful of the nursing assistants. So that was number one. Number two, let's move to the nurses. My nurses were incredible. Just um, very affirming, very gentle, very kind, went above and beyond, advocated for their patients, were not afraid to kind of push against the doctors, and the doctors listened to the nurses.
Huge.
I was like, it happened over and over and over again. So, example number one, Thomas, who was my night nurse when I was in just the surgical telemetry unit, When he noticed, okay, I know the doctor just came in a couple hours ago and said it's okay, but I don't think this is okay. And so he called the rapid response team. Like that, to me, he was completely advocating for me of going, I know my patient, I've spent time with my patient, and this patient is not doing well, and I'm getting people in here. I
Mhm.
truly believe Thomas saved my bowel. Because if we had waited, like everything as it was took, it takes a couple
It
hours
takes
to
a lot
get
of time.
to get the ultrasound, took a couple hours to get the CT, and then I was then they had to schedule the surgery and plan the surgery and get me into surgery. So he got it started really quick. And I believe he saved my bowels,
Oh,
because if it had even taken like a day longer, my bowel
yeah,
probably part of it would have died. So the fact that he advocated for me and got that rapid response team in, and then the rapid response team advocated for me, like truly appreciate it. And then the doctors listen, right? Um, Another nurse, Jessica. This is now I'm in the step down unit. At this point, I had 16 failed IVs. My poor arms were black and blue, swollen, sore. And she's like advocating to the doctor, this patient needs a PICC line because I'm getting all my nutrition through my IV.
mhm,
And that's really hard on your veins. The magnesium, the potassium,
yep,
it's just really, really hard on your veins. And I'm not a great IV person in the first place, as far as my veins handling it. And so finally the doctor says, okay, we'll do midline because they're worried about infection.
sure.
So then the special team comes in to do the midline, and they look at my meds and they're like, hell no, we're not doing a midline. This patient needs a PICC line. Midline's going to fail in a couple hours. You please message the doctor, tell him we're doing a PICC line, get him to okay it. Don't stop messaging till he okays. So they message the doctor, doctor okays. They get me a PICC line, and Bree,
What a difference.
PICC line didn't really hurt. They give you like a lidocaine shot and
Yep.
do it. For those of you that don't know, basically they put it's a the catheter goes from your basically bicep all the way by your heart. And you have an artery and then you
Mhm.
have a main vein. And so they don't put it in the artery that goes directly into your heart. They put it in the vein that goes right by your heart.
Yep.
And so then what happens, because that catheter is so long, it protects your vein from all those meds, and then the meds go into your system.
Yep.
And it was a dream. It was a dream because it did. I mean, anytime you have an IV, like there's a little soreness, but
Mhm.
not like, I mean, you can still see I have some black and blue on my
Oh,
hands.
you're gonna find black and blue and sticky stuff.
Oh,
Got to
sticky stuff.
forget the sticky stuff from all the little patches that they have to constantly remove and then repatch. And I found sticky stuff like 3 weeks
All
later
over.
that I'm
Yeah.
like, because it you can shower, it will not come off. It
Yes.
literally,
Yes.
your skin has to like
Shed it.
you shed, yeah, you have to shed that stuff off, and it
Yeah.
was there forever. It's funny because my son has a broken foot because he has Charcot, which is a diabetic issue, which is horrible. It's when your bones kind of start to turn to powder
Mm.
because your A1C is so screwed up. Anyway, so his foot is broken because he has Charcot and he's in a cast and he has to get it replaced every week or two. And he still goes in to get it replaced. And I can see because when before he was cast, it was really red and swollen, and I was worried. So I took a black Sharpie and drew a line where the red line was on his foot, right? So I could see if it passed that red line or if it went past, it was getting better. And now we go in and I can still see the black line on his foot like a month later as he's goes in to get all this stuff. But yeah, you'll see that stuff on you. The bruising, it was horrible. I had when I had an angiogram, they go through either your wrist or your groin, but they put those things in both places just to see which works better. Because if the wrist one doesn't work, then they go to the groin one. Well, the wrist one worked for me. And the groin one, they have to shave you and everything. And I felt like I should send the nurse. I thought maybe I need to send him a Father's Day card now because we were very up close and personal. It was like I was not expecting any of that. I was like, well, okay. But and then because, and I don't know if you had this with the PIC line, but because they went into such a main artery, you can't move very much when they take it out. You have to sit. I think I had to sit for like 2 or 3 hours without moving because they don't want that to open up again, right? Because it could be very serious. It is going into a main vein and you have to be really, really careful. What happened to me during when I had mine in is, so I got back to my bed and they were like, you have to stay like perfectly flat in bed because I had two of them and I couldn't move. And during this happening, on the floor I was on, there was a gentleman who lost his mind and was threatening the nurses. They had to call the police. And I could hear it because my door was open, but I heard him threatening people, but I couldn't do anything. But luckily they had that little bit. I had a phone and stuff right where I could reach. So I don't know anyone's phone number at the hospital. So I just pressed 0 and this little old lady answered at the front desk. She's like, Regis Hospital, what can I help you with? And I'm like, I'm in room so and so. I don't remember what room number was. I said, there's a disturbance outside and somebody's threatening the nurses and I can't move. I was literally laying there and I couldn't do anything. And she was just like, oh my goodness, let me, I'll check on where, she knew at Flora where I was, and they sent the police. And I was so worried about the nurses because I could hear this guy. It was like out of his mind. I don't know what happened, but, and I couldn't do anything. I couldn't all I could do was like kind of glance down at the phone in my hand and like find the 0 button and push that and try to get help to come up to help them. But you can't do anything when that happens, right? You're stuck. You got to sit really. So that's what you had to sit really still while that.
Yeah. I had an arterial line during my initial surgery
Yep.
right here.
Mm-hmm.
That's how they managed my blood pressure.
Yep.
And then the PIC line, yeah, I had to sit super still, and they the pack they put on it for pressure and stuff. Mm-hmm. Yeah, I had to sit still. But yeah, I tell you what, the PIC line
made the difference.
Made the difference. If I ever go through anything where I know I'm going to be in the hospital multiple days, and
you're going to be like, this is the only way to do it.
Come on, PIC line. And then my last nurse that I really want to shout out is Sarah. I had her for 3 days. 1 day and then a break and then 2 days in a row. And she was there on the Thursday when I just went down in the dumps, when I was like, depression hit hard. Mm-hmm. She was so sweet. She was so sweet. You can do this. You've gone through all the hard stuff. I know you're going to get better. I know you're going to get to see your son. I know, I'm here for you. She gave me some good meds. She's like, I'm going to give you these good meds. These will relax your body. And while your body's being relaxed, once you relax your mind, just so sweet. She didn't make me feel bad for being depressed. She didn't say, oh, you're bringing this on yourself. All the crap you hear from regular doctors are like, oh, you're stressed. Oh, you're depressed. Oh, all your problems are because of that. No, she's like, of course you're feeling down. This has been a long time. I totally get it. Feel your feelings, but know that you're going to be okay. It's like she just has this naturally sweet demeanor and just.
What a difference.
So kind and so very. I just love that she was willing to give me drugs to calm down too.
We like that. Yeah.
She's like, these aren't narcotics. All they do is they kind of calm your nerves down. And so I'm just going to give you this to calm your nerves. Mm-hmm. And I just want you to close your eyes and just relax. And we're going to be okay. We're going to get through this together. So it was like, I felt like I had the nurse I needed at the they each brought something different
that you needed at the time that you needed it.
Mm-hmm. And I just want to, I feel like nurses in hospitals have such a hard job.
They do.
they're dealing with people when we're at our worst. We don't
Mhm.
feel good. We're sad. We're grumpy. I tried as hard as I could to have a sense of humor and make things fun and make things funny,
Yep.
but sometimes you just can't. They're there when you're crying. They're there for all your bodily fluid grossness. They're there, cleaning your wounds and wiping your tears. And they have a really hard job, and that they can do it with grace and dignity and allow you to feel some dignity in a really, really vulnerable place. I just feel like
Mhm.
just a huge shout out to the nurses in hospitals that are there for the right reasons and really taking care of patients and advocating for their patients. I just was
Can't
so
say enough.
impressed.
Yeah.
Yeah.
It's and true, they're true angels,
Yeah.
when they come in, and then that I found that the same way too. I my and when you do when the I did have a couple. There's always going to be one or two that you have that you're just like, I get it. You're just here. You're just punching the clock. You're doing your thing. You're
Yeah.
not. I don't know what's going on in your life right now that's making things miserable for you, but they're still giving me great care. It's just that extra little. But then I have those people that just give that extra bit of themselves that make you feel so safe
Hmm.
and supported when you need it and you're going through a really traumatic experience.
Yeah.
One of the last nurses, she was a nurse's assistant, I believe. When I had open heart surgery, I loved her to pieces. And she was the spitting image and with the personality of Jennifer Coolidge.
Ha!
So, and she had never been told that she looked like her or reminded, and I was like, how could you be as old as you are and never have been told that? Because that is you 100%. I just adored her.
I love
And she
Jennifer
was
Coolidge
I
too.
do too. Imagine, recovering from open heart surgery and you have someone like that that's just like, oh, it's so cute, looks so good. Oh my God, she was amazing. I can't do a Jennifer Coolidge impression at all, but she was funny. And she made me laugh and she made me feel okay. And she made me, even though I look like a mess, like a hot mess, she was just like, you just look beautiful. Oh, you're so beautiful,
Oh.
honey.
Oh.
And so those are the differences that make it really, and that helps us heal. It helps us
Yeah.
move forward.
Yeah.
What's next for you? I know we got to wrap things up. We've got just a couple of minutes left. What's next on this journey? In this, are you still a candidate in this clinical
Yeah.
trial?
Yeah.
Okay. And so what's next for you?
So now they're following me for 5 years. So I had a follow-up appointment on Wednesday.
Mhm.
They're basically following my blood pressure and see what happens. Every I think I'm going to get 3 or 4 more CTAs, CAT
Yep.
scans on my kidneys over the next 5 years. I have so many doctor's appointments, like where I go up to UCI. Then I'll have some telehealth type of appointments. I keep basically a blood pressure diary, and they just follow me for 5 years and
Great.
just see, it's just part of the FDA approval for this device. Um, so yeah, and like I said, I'm very happy with the team. They're all really nice. They're really sweet. And one of the surgeons, one of my urology surgeons, Dr. Chen is her name. I swear she lived at the hospital. I saw her so many times. When I needed my second NG tube, she came in and she's like, "You really need this. You really need this because without this, here's what's happening to your belly. Here's, the dangers it causes. Here's like, she really talked me through why it's so important to have it." And I was crying and I'm like, "Please, it's so miserable. It's this, it's that. I'd rather throw up." She's like, "No, no, you don't. And you're never going to be able to throw up enough and it's going to stay and it's going to be dangerous. And if we do go in and do surgery and you still have all of this, then here's, complication, blah, 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 blah." And she's all, "I tell you what, I'm going to stay by your side the whole time they're doing the NG tube. I'm here for moral support." She's like, I'm a surgeon. I don't do these. The nurses do them, but I am going to be here with you." And the first time they tried it, there was literally vomit at the foot of the bed. They had to change my socks. Like the first time, was horrible. She stayed there. You got this. I'm crying. I'm like, I'm so sorry. She's like, you're doing nothing wrong. It's all good. Second time they got it in, she's rubbing my back. You got this. A surgeon she probably spent half an hour in my room, right?
Oh, yeah.
Um, and there was something mental. Like the little girl in me wanted to please her so much because she
Mhm.
spent that time with me and she's like, I believe in you. I know you can do this. To where every time I felt like pulling that goddamn NG tube out over the next 5 or 6 days, I didn't because I knew that Dr. Chen spent all that time with me. And every time she came in to check on me, I'm like, look, I still have my NG tube. Um, and I mean, I couldn't talk the NG tube. Like I couldn't talk. I was typing everything for a while. It hurt. It was miserable. It was miserable.
Yeah.
But I didn't pull it out because I wanted to please her. And so I just feel like for any medical people listening, little things you do to give us agency, to make us feel like we're partners in this, to make us feel like you see us as humans, to make us feel like you get the struggle and you know how hard it is and you're proud of us for making it through that struggle. Any of that, um, any little piece of that you can give us, medical people, nurses, doctors, nursing assistants, it goes a really long way.
Yeah.
A really long way because it is hard to be a patient. It's hard to not know what's going on with your
It
body.
is.
It's hard to not be in control of what's going on in your body. It's hard to not have answers. And we're not going to get answers for everything. We're not going to always know the why. We're not going to be able to heal everything. There will be some chronic conditions we have to deal with our whole life. But if we feel like our medical providers are our partners, it just makes it so much easier to go through that.
Mhm.
And that's my big message to any medical people listening to this is just we just want to be partners and we want you to see us as humans doing our goddamn best to make it through this challenging life. And we want you to see that we're doing our best.
That's right.
When a half a cup of soup destroys our body,
Yeah,
like that's a big deal. That's a
it is.
big deal.
It is. Well, I am so glad that you're home in bed. I know your back is hurting. I know you've been through a lot and there's still a lot of healing to go on,
Mhm.
but we are with you and we are also your support team. Everyone in the chat and everyone that's listening, and me and my dogs who have decided to make lots of stuff going on in the background, which I'm trying to keep quiet.
They're
Um,
cute.
but we're just thrilled that you made it through all of this and that things are getting better. And we're happy to bring everybody in the audience along on the ride with us.
Yeah.
We have exciting things coming up
Yes.
in January. We will be back in January. So we will wish you all a happy holiday and a happy new year. But we've got guests that'll be coming on. We have new things going on. We have a community, which I will link in the description. We would love to see you over in the community. Tiphany, thank you so much for bringing us along at of your really vulnerable times and sharing that with everyone. I think that's really important. And I know it's not always easy, but you're sharing your life. You were sharing so much the entire time. If you haven't, go follow Hurricane Tiff. We would love to learn more. We'll see you next time. Thank you, Tiphany.
Thank you. Love you all.
Bye, everybody.